Thanks so much to both of you for the invitation to speak. And I just made a transition from the West Coast to the East Coast, but this work has sort of spanned the last 2 years. And most of the people that I'm working with actually are neither in Seattle nor Charleston. They're in places all over the country. And you'll hear a little bit more about that as I go through. So I think, the first question that I had was what's out there and how do I find them? And the way that I'd like to do this talk is kind of take an example disease process as a surgical problem that can be triaged using an mHealth app, and that example is surgical site infection. And by way of that, I'm going to explain this project that we've been doing that's funded by the Centers for Disease Control that was essentially in a health technology assessment and production of a report and recommendations on what to do next about this clinical problem through mHealth. And then finally, I would like to mention that the American College of Surgeons is starting a new initiative called the ACS Surgeon Health IT Toolkit, and I'll give you some details about that. So I think we're all very aware that post-discharge is a vulnerable time for our patients. They're primarily responsible for their own care, our patients, once they leave the hospital. And it's very apparent that more than half of the surgical site infections that occur now are happening outside of the walls of the hospital. And much of this is to do with the shift towards more minimally invasive surgery, but also our obsession with keeping hospital stays short. And we also know that if you do very good post-discharge surgical site infection surveillance, you find that there are more surgical site infections than you thought there were. And there's also some very interesting nursing research that demonstrates that patients are not very good at discerning when their surgical wound is infected, and they may actually over-triage themselves if they're educated as to the signs and symptoms of SSI. So we have an opportunity with the Internet of Things to really embolden our patients to be better data accessors, acquisitioners, transmitters. We no longer show up at their house with a bag. We still use the telephone, however, and this is really our primary means of contact to patients after they leave our four walls. But every patient, just about, is walking out of the hospital with one of these, or at least a family member that has one. And increasingly, including myself, I just finally got an Apple Watch this past week. We now are able to track biometrics in a very easy way. This was a couple of years ago when I first started this work. I got an email from a patient that sent me a wound picture that looked like that, and I'm sure that you're still getting these. Patients find it very easy to contact us, whether it's the patient portal or our own personal email or our mobile phone number, with these kinds of wound photographs. And so we had a lot of interest in my research group at UW, where we looked at all different ways to be able to analyze this information. Could you use machine learning? Would wound photography actually improve our accuracy in detecting surgical site infection? And is there a trouble with the quality of the photographs? And we answered all of these questions. And the point of my talk today is not to go through my previous research, but just to say that this is a problem that we've been studying for a while, and we really do think that the use of patient-generated health data is important, but it's not easy. I mean, the apps are not the answer. We have the ability to get this kind of engagement with patients, but we have to want to engage with patients. So I would posit that one of the issues is not the tool, but the people using it. And the clinic really wasn't built for this kind of interaction, and now we're not even using the clinic in the same way we were, and these data streams really don't fit into our workflow. So here are some of the big challenges that we face in enacting these new processes that are dependent on patient-generated health data. So we got a grant from the Centers for Disease Control. A couple of us at the University of Washington. I have a a collaborator who's a bioinformaticist, we have a patient engagement expert, and a project manager, and we connected with a whole bunch of people across the country that are doing this kind of work. And we did this 2-year health technology assessment, evaluating the current state of SSI detection, monitoring, and reporting using PGHD, primarily using apps. And basically what we were looking at is the intersection between acute wounds, mHealth, users and their data, analytics, and looking at these areas of interest: communication, decision-making, care coordination, and population health. We did an evidence review, and we found that the state of the literature right now is quite early. There's a lot of feasibility and pilot studies that have been published, and there's really only 2 now randomized controlled trials of mHealth apps for surgical site infection management. We also did some key informant interviews, and we asked a lot of probing questions to try and find out, what are people doing? We looked through all the available mHealth apps that were out there that were used to track surgical sites, surgical wounds, and surgical site infection. You can see some of them here. And then we held a patient-generated health data stakeholder advisory group workshop. And we brought all of these people together, and we had 7 workshop sessions and talked about the information that we had gleaned from the evidence review and the key informant interviews. And we talked about how things were really progressing. And we met John Semple, who has been doing some really seminal work at the University of Toronto in this regard. And we made some recommendations on the basis of our report in 5 different categories: development, workflow, the definitions of SSI, which are changing because of this data that we're acquiring from patients, that we should really be building a community of practice that understands how to use mHealth technology and the rest of the other patient-generated health data, and how would we evaluate this. And I just want to point out that there are 3 really key areas that we uncovered, and one of them is that stakeholder engagement is absolutely critical with mHealth apps. You can't just build an app. You have to have input from the people that are going to be using the app. The user-centered design aspect of the development of all of these kinds of apps, whether they're for health or otherwise, is absolutely integral to whether or not you're going to have a successful implementation. But you also need to think about the workflow impact. How is this going to change the way that you're communicating with people? Is it going to leave certain people out? If it leaves people out, are you still going to have the previous data streams available to them? And what does it do to the clinic workflow? And really, the bottom line is that I'm describing implementation science, that you really have to think about the impact of your work, the impact of the tool that you're introducing on the people that are going to be using it, and that certainly will have impact on your outcomes. So we're going to have a symposium at the Surgical Infection Society meeting in June this year, and the final HTA report has just been sent to the Centers for Disease Control and Prevention, and we'll have it available at the Clinical Congress in 2019 this fall. My last slide is just to mention that the American College of Surgeons is also starting a new project this year. I'm the chair of the Health Information Technology Committee, and we have the charge to create searchable web resources of vetted mobile health apps that are evaluated by your surgeon peers. And the reason that this has been introduced as an idea is that we really wanted to be able to advocate for some of the very good health apps that are out there and emphasize which ones actually will bring education, clinical improvement in care, and a host of other categories, all aligned within the 5 pillars of the ACS. And we are projecting our launch of this project in fall of 2020. I don't have any more details about it right now because we're actually creating our processes as we speak, but eventually any member of the college will be able to submit an app for review, and that app will then be put through our review process and scored. And the highest rating apps will be available on the website. So I have a lot of people just to thank for the work that I've done in the last couple of years, and especially to Danielle Walsh, who started this project for the ACS HIT toolkit, and I hope to have more information about that in future meetings. So thank you very much for your time.